After some time, you're like, I don't know. I don't feel that, there's a problem again. So then I was facing adding another medication, right? That's what happens with people. You max out on one and then you start adding something else. So then I started doing the holistic, checking my hormones and nutrients and start really living a healthier lifestyle, not so much from a diet and exercise perspective, but from addressing nutritional elements, hormonal elements.
Are you going through life blind? This is Eyes Wide Open with Nick Thompson. On this podcast, we share knowledge and stories that build human connection while elevating stigmatized societal issues such as mental health, holistic wellness, culture, free speech, and more. All to ensure we show up in the world with our eyes wide open.
Hello, everyone, and welcome to this episode of Eyes Wide Open. I'm very grateful you're here. Before we meet our guest today, if you like this show, enjoy the content, please like, subscribe, share the show with a friend or family member. I also appreciate if you leave reviews. It helps the show out, helps us find more people. But our guest today is Dr. Joy Kong. Now, Dr. Joy is a triple certified physician by the American Board of Psychiatry and Neurology, the American Board of Addiction Medicine, and the American Board of Anti-Aging and Regenerative Medicine. She is a practicing regenerative medicine physician known for her groundbreaking work in stem cell science. She's an educator, an author, an entrepreneur, and a podcast host. We're not even done yet. She's also the recipient of several awards for her work, including the top doctor in stem cell therapy and the stem cell doctor of the year, or of the decade.
The year in 2019, the decade in 2021. Yeah.
Thank you for clarifying. Now, she's also the founder of Chara Biologics, where she provides cutting-edge regenerative medicine treatment, and she's the founder of Chara Omni, which is a natural cosmetics company providing products that harness the power of stem cells and peptides into your skincare. And she also founded the American Academy of Integrative Cell Therapy. My first question is, do you require sleep? Because, wow, you have a lot of work that you're doing.
They do start to add up. So it wasn't everything all at once, but I just keep adding things on. So that's one thing I'm not doing as well, which is sleep. Everyone talks about how important it is, and I'm not giving myself enough sleep. So I get excited about working, and I have so much to do, so I just keep at it. So that's one thing I can improve on.
Yeah, well, that's good. And there's probably some relatability there, because I struggle sleeping. I always have since I was a kid. And I'm curious to ask you this, because I've heard you say before, you're just like very curious, and I'm very curious too.
Mm-hmm.
And I find myself in like, I don't even want to say rabbit holes. They can be rabbit holes, but like I get, stuck on a topic, and then I'm like, well, I have to know everything there is to know about this topic. And then it's like, I can't stop thinking about it. I don't know if it's similar for you, but
obsessiveness, I've definitely recognized that all my life. Obsession, yes.
Yeah, maybe that's a good word to put it. I like to say driven or curious or, wanting to acquire information, but maybe it's obsession. That's a better way to sum it all up.
All of it.
So I am very grateful to have you on the show today. We're going to talk about everything that you're doing and the pioneering work that you're doing in regenerative medicine, stem cells, all of that fun stuff. We'll talk a little bit about peptides too, which are all the rage on social media right now and everywhere except in mainstream media and mainstream medicine. But before we get into that, you have an incredible origin story. And I always ask my guests about their origin story in the way of, what did you
do you have?
I know. When I was looking and researching for this, I was like, I might just ask her that, sit back, kick my legs up, put them on the desk, and let her tell her story, because it's incredible. And I think it's like such a organic progression that you've made. So please tell us what you wanted to be when you were a little kid.
Absolutely. At age 20, I had no idea where I was going to be. I wanted to be in America, but my first visa attempt was rejected. So that's where things started. Everything else before that, it was great. I grew up on the university campus in China, but I wanted to come to America because it's so exciting. But then my visa was rejected after working really hard for 18 months. So that's where I my journey, when you talk about, not knowing, how did things happen the way it is? Yeah, it's very organic. And when you're in the middle of it, you don't know where you're going to end up, and you don't know how this is going to turn out. And I had no idea. After my visa rejection, I just knew that I wanted to be in America. I didn't know, I didn't care what it would take. My thought was, if I can just get there, the first place I'm going to go to is a Chinese restaurant where I'm just going to wash some dishes, and I'm going to make it. So that was, but it was rejected. And then I had to go on a kind of an unconventional path to get myself over to America. So that's where I wrote it in the book, Tiger of Beijing. You see the tiger behind me, but it's
I
Tiger
love it.
of Beijing is on Amazon. There's a, Audible version as well. But, I had no idea what I wanted to do. I mean, I knew I wanted to be in America. I was studying architecture at the time. So I thought I was going to come to America studying biology because that was what I was interested in, even though I loved architecture, but I didn't think I would be able to get any scholarships. So
Oh, interesting. I
and
didn't know
then when
that
I
part.
got to America 8 months later in San Francisco, the world was wide open. And I thought I was going to do photojournalism because I do
Mm.
like the artistic aspect of photography. And journalism was because I thought would be the most challenging to challenge myself using a language that's not even mine, right? I didn't grow up with. So I had these, I don't know if it's a brilliant idea or not, or just, really stubborn. I thought, what can make me grow more? I think the more difficult it is and the more challenging, then I will have the most amount of growth. So what could be more challenging than competing with the native speakers in their own language? So I was trying to
Wow.
set myself up, seeking challenges. But eventually what really was exciting me was life itself, the mystery of living entities, right? I don't care if it's plants or animals,
Mm.
things that are living, having a life of its own. So that was just, it was too exciting. So then I went into science, biology, but I didn't know I was going to be a doctor. I thought I was going to be a scientist studying neuroscience because I love the brain, right? That's why, later on I went into psychiatry. But I didn't really, I wasn't crazy about research because I thought it was very narrow. You're spending years answering one question. I'd rather making an impact in people's lives. So that's where medicine, it was a perfect fit because you can use science, you can use your ability to understand and track science, but put that into a place, into work that you actually are changing people's lives. So once I found medicine, that's it. Yeah. So, but there's a lot more to the whole story. But eventually I landed in holistic medicine because I did practice psychiatry for 11 years. Um, I was really good. I was loved by my patients. I'd helped so many people, but I saw the limitations because we were focusing so much on the brain that we forgot
Mm.
everything else in the body is affecting it. If you can address everything else, you probably won't need those depressants and anti-anxiety medications or even antipsychotics. So if we can just do everything right and build the body the way it should be functioning, then the brain could be functioning just fine. So that's what led me to this holistic practice. And very quickly, I encountered stem cell therapy, which medical school told me nothing about. I mean, we knew that there were stem cells. That's pretty much it.
Mm.
That there's primitive cells that can help regenerate, but really nothing. Right? It's a drug-focused education, not even nutrition. We had half an hour of nutrition, so it was very, very much. We were groomed to be the ones that deliver drugs. So that just giving you the bottom line.
Yeah.
Hopefully things are morphing and changing, but that's not good enough because nobody has a drug deficiency, right? Everybody may have a vitamin mineral deficiency, may have, lacking antioxidants in the body. They may not have the right energy flowing through their body. They may be toxic and, the hormone levels are off. So why don't we look at those? But no, the way we were trained, we looked at just about none of them. Maybe once in a while, there's toxicity, we can check it. When the hormone is really out of whack, then maybe we'll look at it. But never mind when it's just a little bit of out of whack, and people are having just symptoms here and there you can't figure out. But no, we didn't check it. We just let people suffer, basically. And then we start throwing different drugs to camouflage the symptoms. So that is just not intellectually satisfying. That's not how I want to live as a healer. So that's what got me so excited about anti-aging and regenerative medicine, which is a way to remove all the causes of decline. If you can remove all these little causes, voila, you're vibrant, right? And you can live a long time. And then utilizing stem cells or exosomes, all these are signals, peptides. These are, they're all part of regenerative medicine because it helps your body to actually become new again. So we're not, forget about just reducing the symptoms. Let's make new cells, make new tissue. That's the goal. So, and how exciting is that, right? Who doesn't want to be new again rather than just being camouflaged, tricked into thinking that body is okay? Yeah.
Yeah, absolutely.
So that I thought was incredible because I know, and I think a lot of people are starting to wake up to know that our doctors who are, I think doctors are 99.9% good intentioned when they go into medical school, right?
Yes.
Because they want to help people. That's usually the driving factor of wanting to be some sort of doctor. But then you get sort of, as you said, groomed or indoctrinated with the, medicine approach to things. And before you know it, no nutrition class, like that's crazy to me. I when I hear someone say that as a doctor, it's like, how can you not have a nutrition class? And so what I wanted to ask you, because I agree with everything that you said, and I think it's all very important to recognize that like you're masking symptoms with most medication. You're not actually getting to that root cause. And to your point on cell regeneration and making sure that we're eliminating the bad in our body as we age and replacing it with good. But you spent the first, what did you say, 20 years of your life in China, where you have probably learned just organically a different approach to medicine. So I'm curious how or if any of your, Eastern style medicine sort of influenced your curiosity when you were,
Yeah,
in the
you
medical
bet.
system here.
You bet, tremendously. Since growing up as a kid, at my home, there's no prejudice against either Chinese medicine or Western medicine because we know one of them works better in a particular situation. So depending on the situation. So my mom is the one that's always diagnosing me. She loves medicine. She's not a doctor, but she's a chemist. And she was just asking me, oh, what are your symptoms? And depending on what the symptoms are, she will put her hand in the medicine drawer. She'll be, you know, just searching for the right one. It could come out either be a Chinese medicine medication or a Western medicine. So and so we know that nothing works for everything. It's a time and place for each different approach. And then of course there's acupuncture. We heard about acupuncture and how well it worked. And we even had people coming to school teaching us teaching how we can brighten our eyes, how we can, have better, maybe, processing speed, just enhancing our brain function by putting those little beads on your ears. So this
Really?
is like kind of part of, it doesn't matter. So we have practitioners coming into a school. I remember showing us all these, little beads and my mom, that this is one of the most profound example, which is when my mom got multiple myeloma, right? A very scary form of blood cancer. So bone marrow cancer. So everyone thought she was going to be dead within a few years. I was only
Yeah.
13 years old. And she was in a hospital for 6 months, living in the hospital, getting 6 rounds of chemotherapy. And a lot of she lived in this giant ward where there's, I think, 7 other beds. But she
Hmm.
was witnessing people walking in and then get carried out on a stretcher dead. So after 6 months of seeing that, she said, I'm done. Because she passed out, with all her chemotherapy every time. She lost a lot of hair. And she said, I'm done. It's over. I no longer want to go through this. So I'm just going to go see a Chinese medicine doctor. And so she came home and she got this concoction that was prescribed by this Chinese medicine doctor of all these herbs and, animal parts,
Yeah.
everything together. And my dad would be brewing that nasty smelling, brew. So she would be drinking it morning and night. And then she went to do aerobics every morning for an hour. That's it. That's the only thing that's all she did. Within 6 months, everything came back to normal. She was healed. She went back to work. and she lived for another 32 years, very productive years, traveled everywhere, having fun. So that was an example. And it was so shocking to the point where the attending physician, the chief on that ward, came to our home asking my mom what the concoction was. Like,
I
how
had no
was she
idea.
able yeah, how did she get healed? So he actually implemented that brew to his ward to give to his patients to really
Wow.
nourish your system. Instead of, yes, he was still doing the chemotherapy, but at the same time of assaulting the body, killing things that don't belong, it killed all these good stuff. So you need things to nourish you, and to repair. So that was a really good example of seeing what Chinese medicine did. Saved my mom's
I
life.
mean, from cancer, something that is a death sentence in this country for many
Yes.
people, especially if you get bone marrow cancer.
Yes. Yeah. So, and then China started to open up in the mid 80s, because before that, because it's a communist country, it was very much against anything that's supernatural. So like Qigong, which is the practice of the Chinese meditation, it didn't really like that. It didn't like people tapping into their qi, their energy. But there was a revival of the culture, in the old culture. So I started hearing stories of people getting healed by these energy healing. And there are just so many examples, to a point where you just can't deny it. You can't say, just, one time, that's, a fluke. It just over and over. So everyone knows it's for real. This is just
Hmm.
a fact of life. There are energy, just like meridians and energy channels, but there are other things that could be even more profound. When we know people that can see other people's organs, how do they do it? This is not an x-ray. Like, what's
Yeah.
going on in these people? Like, how can they, science couldn't explain, right? How can you see someone's organ? But you can't deny. So that got me really interested in ESP, or just in a different way of looking at the body. So I've always been really open, because I knew there are mysteries to life
Yeah.
that science we have can't even explain. So that's always at the back of my mind. Even herbal concoctions, we don't understand how they work, but doesn't mean that
Hmm.
they don't work. Just like acupuncture, just because you haven't found the energy channels doesn't mean that they're not there. So yeah, that's kind of the journey, and the influence by the culture.
Well, I think no wonder you're curious, because you've seen and experienced these things in your very own everyday life that contradict everything that you would read in a school book or learn in a classroom. And I've always believed in, as I've gotten older, I grew up Catholic, so I was very like religious when I was younger, and I kind of broke away from that as I got older and started being a little bit more spiritual. But like me, with my experience is like, I feel like we're all just balls of energy. And when you're this like ball of energy, which can be multiple different sources of energy, right? I just feel like there's no way you can ever really understand everything there is to know outside of the biology and the chemistry of medicine and all of that stuff. So the fact that you can kind of connect, and I'm very intuitive too, which is kind of where it started with me. Like, I can sense things, I'm empathetic, but I can also sense like people's auras and vibes and their energy. And sometimes it's just by like walking by them. Like, for example, this is totally off the reservation.
But I mean,
There is,
I'd love to hear
there's
it.
this, there's this down the street here. I live in Chicago. Most people know that listen to the show, but I live in Chicago. There's a psychic that I refuse to walk by, because it just gives me weird vibes. Like, I cross the street and don't walk in front of it. So it's
Interesting.
like, yeah, it's like, so I believe in that. And I believe, like, for your experience and your curiosity, of course that would peak, especially when you did finally get here in psychiatry. And I heard you say this on another show that I listened to. I wanted to ask you, when you were in psychiatry and you were helping people, you're doing good work, you made a comment that, oh, well, like, psychiatry puts everything on the brain and ignores the rest of the body. And that was one of the things that I wanted to ask you to elaborate on, because I talk a lot about mental health on this show. We have a lot of experts in counseling, psychiatrists, psychologists, neuroscientists, all of that. And it very much focuses on the brain and the behaviors and the thought processes and stuff. So what was
Mhm.
your experience like? And how did you determine that there was more going on for most people than just in the brain?
Well, we know there's way more going on, because so many conditions have a mental component. So they will have these neurological or mood symptoms as a result of the problem, like hormone imbalances or toxicity, and yeah, or or even, like things like fibromyalgia. So there's a lot of connection to your mental health issues. It's just a matter of whether or not the people who are treating mental health problems is actually paying attention. Something as simple as nutrient, right? Omega-3. I mean, that has a lot to do with mood and depression. We were just, when I was in residency, so that was like 2001 to 2004, around that time. No, yeah, around that time. That was just when the beginning of people starting to talk about omega-3. So it wasn't even on our
That's
radar.
crazy.
We were just we weren't paying attention to nutrition at all. So and we know so much of the brain issues have to do with neural inflammation. So your brain is inflamed. The cells cannot communicate well with each other. Yeah, the signals are not passing through and you don't feel good. So you don't feel good and you can't think straight, and it warps your perception and warps your ability to adapt. So, of course, this is almost intuitive, but when there are studies, I wish there are more studies, but I think it's emerging as a field. Functional psychiatry is becoming a thing. It was, there was nothing before. When I was in residency, I was thinking about incorporating Chinese medicine into psychiatry, but it's very difficult. It's because it's such a different language. But what I love about functional medicine is that it's actually dissecting all these potential system errors, either nutritional or hormonal or toxicity or even microbiome. From all these aspects, now you're using the language of Western science where people can understand, instead of the heat and dampness and wind, and people have trouble putting that together with the science that we're talking about. So now we have a language for the science, and because one nutrient could be representative of maybe something that Chinese medicine was talking about, one of those weather patterns. So I think, we are awakening to the new way of looking at mental health. For example, I know a doctor who refused to give people antidepressants when they're depressed, unless they've walked every day for an hour a day, and then they can come back. If they still are depressed, okay, he's going to give them medication, but not before you've tried that. And lo and behold, almost all of them never needed.
That's my story. I've dealt with symptoms of depression since I was like 6, 7 years old. I remember it. And I never knew what it was until high school. And when I, left a Catholic school and went into the real world of a public high school, and, people talked about other stuff besides Jesus. And I just dealt with this. And then in my 20s, I tried a bunch of different antidepressants, and they all kind of just made me feel off in one way or another. But when I started walking for 30 minutes every morning as a non-negotiable, unless it was like storming, like I'm out there in the snow in the winter, even when it's below zero, for as long as I can physically manage it. And so I start my day, and I got a dog, which helps. 30 minutes. I get outside in the afternoon for another walk, and I get outside after work for another walk. And I do more in the summer when I can. And the structure of having that walk, I'd imagine. I also found out I had low vitamin D, so I think that helps with it as well. And I don't take any medication. I do supplement. I do take omega-3s and then some other stuff too, but it's all like over the counter stuff for it. And, I still get depressed, and I still have tough times, especially in the winter, but like I don't need medication and I can still function. And I haven't had one of those days where I can't get out of bed since I started putting this movement structure and sunlight.
That's a beautiful example. And that just like you only tapped into two things, right? Exercise and vitamin D. Imagine if you peel more layers of the onion, you probably will get to a place where you're never going to feel that way. At one point, I was on the maximum dose of Prozac. This is like probably, 10 years ago, before I got into the holistic medicine.
Yeah.
I was at the max, but I was still feeling, because when you are on a higher dose, after some time, you're like, I don't know. I don't feel that, there's a problem again. So then I was facing adding another medication, right? That's what happens with people. You max out on one, and then you start adding something else.
And you never take anything away. You just keep adding.
Right. And unfortunately. So then I started doing the holistic checking my hormones and nutrients and start really living a healthier lifestyle, not so much from a diet and exercise perspective, but from addressing nutritional elements, hormonal elements. And then I was able to cut the dose down, of course, I think 5 years ago, maybe even more than that, I was completely off any medication. I feel great. Do I have stress in life? Yes. But in general, I feel great. So that's an example of when you keep peeling the layers of onion using the new way of understanding the body through this new functional medicine, integrated medicine approach, then a lot of the mental health issues can go away. I've heard
Yeah.
people doing that even for bipolar disorder. It's absolutely
Wow.
amazing because that's a tough condition. But I actually just met somebody who was able to help himself using that, even ketogenic diet. So
Yeah.
there's so much power to what we can do ourselves. Yeah. And then of course I added stem cells, which is very reparative for the brain.
Right.
I've seen examples, animal studies, as far as reducing addiction, reducing alcohol addiction in animals, in alcoholic animal model. But in my own patients, people start to lose interest, this intense interest in their alcohol. They're like, I don't have as much of a, excitement about my alcohol anymore. Yeah. So naturally it just calmed this, I think, a circuitry issue
Right.
because of inflammation. Yeah.
So tell us, that's a great segue. In lay people terms, explain like stem cells and what they are and what they do when they enter the body and how they
Yeah.
already exist, maybe too, so people know that.
Right. I always start from the beginning. So, we really, we all came from a single stem cell, period. And when that stem cell, the definition of a stem cell is that it has the ability to replicate and to differentiate. So become something of a more function, be able to gain more function, and at the same time keeping a copy of itself. So that's really stem cells. When we have end organ cells, so when we start to have like heart muscle cells, so that's it. It's done. Muscle cells, right? That's it. It can't become anything else anymore. It has reached its final state. But anywhere before that, there's an evolution from that single fertilized egg, that evolution of forming an embryo, all these structures, these organs, or early semblance of an organ, until you got more cells to perform the final function, like pumping the heart. Now you've got working cells. Anywhere before the working cell is a stem cell. So you can imagine, from that little, well, you can, no one could even see us at one point, right?
Right.
We were invisible until we start to become a tiny little embryo, and then we grow and grow, and to the point where we're so giant that we had to come out of the mother's womb. But that is a fully formed human, the newborn baby. So in the embryological standpoint, that's an adult. So we call those, so if you get stem cells from that baby, it's considered an adult stem cell. So that's how mature the baby is. But anywhere before that, the cells were more primitive. So when we get cells from the umbilical cord, and that's the source I use most, well, at this point, until we can find a better source. But right now, I think that's the best source. What's making that special is that when the embryo was forming, and you have to form the umbilical cord, right, to attach to the placenta, and those tissues have been formed so early on. When the embryo was developing, a lot of the early cells were trapped in those tissue, so they retain a lot of the characteristics of the embryonic stem cells. And when the fully born new baby, if you get cells from the baby's body anywhere, the blood or any tissue, those cells are not going to be as young as the cells in the umbilical cord. So the umbilical cord cells are actually in between embryonic stem cell and the baby's stem cell. So there's so many variations, because when we were forming as an embryo, there are different layers of the little fetus of the embryo. So there's, outer layer, middle layer, and inner layer. And right now, the cells that we use the most come from the middle layer, mesoderm. And it's not just that this layer can form muscle cell, fat, and bones, and cartilage, etc., but it can also become like a resident, like a sentinel, like this guardians throughout the body. So they are populating everywhere. Anywhere you have blood vessels, we got these cells that derive from the middle layer. And they have the ability to sense what's going on in your blood and in the local environment. And they can send signals to your body, either locally or systemically. So your body know how to respond to an injury, to a dysfunction. So that's a special category of stem cells. So when people talk about mesenchymal stem cells, that's what we're talking about from the
Okay.
mesoderm. But there's still all kinds of other stem cells. In all your organs, there are stem cells that can differentiate to produce the final working cell. Your heart has the precursor to the heart muscle cell. Your liver also has precursor. So everywhere in your body, and that's how using mesenchymal stem cells to help with regeneration has a lot to do with using these cells' ability to signal. They send out signals, including to that local area. Using the example of the heart, talking to the heart muscle precursor cells, waking them up. So it's not so much that we're making these mesenchymal stem cells differentiate, and we have to count on their abilities to become the local cells, because research have shown over and over and over and over again, a lot of people don't understand, is that we don't have to put the cells into those areas thinking that if we don't put it there, how are they going to regenerate? How are they going to make new tissue? No, research have shown ad nauseum that is not the cells that are differentiating, is that the cells are sending signals. So your own stem cells right there can start differentiating and make new tissue. So that's the common misconception that people
So it
think that.
doesn't have to be localized. So like I
No,
talked a little bit about my hip, but so I don't need that injection in my hip to work
you
on my
may
hip
not, but
because
the joints is a little bit so joints is every joint is a bit of a special category, because you do want signals to be in that area, so you can signal your hip have cartilage, right? You want to signal the cartilage stem cells to differentiate and make new cartilage. But if you don't put cells there, if it doesn't have contact with the signals, then there's a problem. The problem with larger joints is that it's kind of sequestered little space. It's walled off by the joint capsule. So if I put cells just in your blood, it's going to take 2 months for any elements I'm putting in the blood to actually equilibrate and get into your joint space. So that's why for larger joints like the hips and knees, shoulder, we put it right in the joint space. So now you have contact. But I also put them into the intravenous system. When you put in the veins, of course, the first thing it goes back to your heart that gets pumped into the lungs, and then it's oxygenated and it's put back into your heart, and now is pumped everywhere in your body, right? So now you get everywhere, including outside of the joint. So your large joint, like your hip, the cells are going to flow through the blood vessels that are nourishing the outer part of your joint. And that can also signal the outer layer of the cartilage, because the outer 1/3 is nourished by the blood supply. The inner 2/3 is nourished by the synovial fluid. So now you got to attack from both angles, right? So you need to understand the physiology, the anatomy, so that you can offer the best approaches. So I always approach from both ends when it's a chronic arthritic type of problem.
Yeah. One of the things that I found interesting on my like stem cell journey is there's a little bit of a stigma might not be the right word, but I remember when I was telling people, "Oh, I'm doing," and me too, like I didn't know that it was legal in the US
Mm,
because you don't see it unless you like know someone or you see it on social media or something. So,
mm.
you know, this sounds, and I know from personal experience it is like a very rejuvenating treatment, but why is it so unknown in the US?
So the systemic suppression is working. So you just basically told the story of how it's working. First of all, I thank God the US, the FDA is not outright saying that we are prohibiting people from using anything related to stem cells. It's still We still perform the most stem cell therapy compared to any other country in the world. So whether or not people think that it's legal, not legal, it doesn't matter. We do the most amount of stem cell therapy in this country. So just the sheer volume of providers. But as a governing entity, what the FDA said, it didn't want to be completely on the wrong side of the history. So it did say, if you do not manipulate the cells to the point where you're changing it so much that it becomes a drug in our eyes, then you can use it. You can give it to people as a tissue transplant. So thank God that they're willing to allow providers to do that. Because really, when you look at medicine, how we've been practicing medicine, we do grafting, right? We do bone marrow transplants. We do blood transfusions. We can graft, one person's, organ transplants. There are things that we can move things from one human being to another human being. And that has always been governed by the practice of medicine. So that is controlled by the medical board, because if you're a doctor, there are certain standards you need to adhere to. You can't just go do anything you want. It's better be safe, better have some kind of evidence. So that's what the FDA came up with, that if you don't change the cells by using enzymes and chemicals to alter it, and you don't grow them to this large numbers, you don't induce them to become something else, then you're doing pure tissue transplant, and that's fine. So that's why a lot of doctors are able to do it. And now I think just more and more they're really mushrooming. What I heard, so I don't know the most recent statistics, but back a year or two ago, the statistic was that within 5 years, the number of stem cell clinic had quadrupled.
Wow.
So that's how fast it's growing. But you don't know about it. Guess why? Because you can't run ads. Because Google is not going to let you. Facebook is not going to let you. Instagram. So all these places, they're going to shut your ads down. So you think you can just pay money, run ads? No, they don't want to take your money. They don't want it. Well, you take a guess who is behind it. I have helped so many people get off medications completely, be well. And so I'm not good for the bottom line, right? I'm not a friend to the whole industry that relies on drugs. So there's definitely systemic suppression of the information. So if you can't run ads, you can't talk about it, because there are doctors who have been targeted, who have received letters. Imagine you're a little practice, your doctor doing your thing, treating patients every day, and you get a letter from the FDA saying that you mentioned stem cells, blah, 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 and there's some, big scary words. Then people get scared, and so they stop doing it. Whether or not what they were saying make any sense, that's a whole other matter, but a lot of people are easily scared. So then you got the scared doctors who don't get into it or stop doing it. And you got the brave doctors who believe in what they're doing and know that is extraordinarily safe and has helped a lot of people, and they're going to do it anyhow. So, and then they're doing it within certain parameters, right? Like what I do is that I don't use cells that have been manipulated. So we're using the pure tissue transplant. And we don't make any claims. I'm not claiming it's going to treat any condition. That's just, I would never say that. We always help a person to improve their ability to repair. That's all we're doing. Yeah. So that's one reason that you do not hear about it, because it was make sure that people don't hear about it. Yeah.
Yeah. I remember as a kid, I was a big Superman fan, like Christopher Reeves. And I remember as a kid, he was after he was injured and couldn't walk, he was pioneering stem cell stuff. And then I never heard about it again until 3 years ago. I remember that thing as a kid, because I just really wanted to see him play Superman again, how ignorant of a 10-year-old or whatever. But I just remember that, and that stuck with me. And then I heard about it again 3, maybe 4 years ago. But and I follow the holistic space, the functional space, health and wellness, all of that stuff. And it just was off of my radar until a few years ago.
But guess what?
Yeah.
It was off my radar until 10 years ago as a doctor. I had no idea that anyone was doing stem cell therapy. The first time I heard it 10 years ago, I was really surprised. I was like, you mean you are using it on humans? You're actually putting this into people's body. It's not just in research. I mean, that's how ignorant I was, because there's no reason for me to know unless I run into somebody that has done it, or I'm just searching, I'm searching for it, but I didn't, why would I be searching for stem cells? There was no particular reason.
Yeah. It's not even on your radar. That's the whole thing.
How did you get introduced to them, or how did you discover them at that time?
Well, it was just a random. I was trying to get board certified in addiction medicine, and I
Hmm.
was in the same on the same bus with a doctor who was doing anti-aging medicine. And then he said he's also. What's funny is that when he said he does anti-aging medicine, and I said, "What's that?" And I had
Yeah,
no idea what that meant.
that's crazy.
And he was the one that told me that he was using stem cells. He used umbilical cord stem cells, and he was treating this little kid with autism. So he said, look what the teacher said. So he gave me this whole list of like over 40 things that the teacher has sent him, basically sent to the parents saying all these
Yeah.
improvements. So all these things, better eye contact, better ability to communicate, can play with kids better, not procrastinating. So like a long list of every change. I was shocked. I said, because he was an anesthesiologist who was switched into anti-aging medicine. So he really, and I was trained in autism, right? That's my field. I'm in psychiatry. I've seen a ton of autistic kids, but I couldn't do what he did. And I said, how do you know how to make all these difference? You just did what? You just give an IV infusion, one IV infusion, and you were able to achieve all this that I cannot achieve in 10 years for this child. So I got to know what's in these cells. Like what are these? How can they do all these things that I have no way of achieving? So that's what really, so talk about intellectual curiosity,
Yeah.
because I've seen doctors who have seen incredible results. Like I saw, actually a doctor who works at an Amen clinic. And I said, look, you guys see so many, brain diseases, mental health issues, dementia, and look at what this case, there was a case sent to me by a doctor who did stem cell therapy. Yeah. And what he did was that he, got a pre-treatment clock, right? That's one way
Hmm.
of looking at cognition. And the clock was completely skewed. Like all the digits were squished on one side. I mean, it was like 10 after 10, it was completely unintelligible. And then a few months after stem cell treatment, the clock was pretty nice. You got all the digits and it was a good clock. And I said, look at this within a few months with one stem cell treatment. And then this is a doctor, a psychiatrist. He said, but that's N of one. N is the number of study subject, right? That's one person. And I was like, but can you do this with anybody with what you're doing? But if this one thing can achieve this, don't you want to know how? Why? Like instead of just shutting down, oh, that's just one case. So that's the kind of arrogance I've seen in my colleagues. And that's unfortunate because
Well,
he's doing his own patients injustice. Yeah.
I was just going to say that. And I think too, one thing is I've grown older. I'm 41 now, and I've realized like people get stuck in their thought patterns too, and they don't want to be wrong, and they don't want to be misinformed. And the last several years I think has really like opened my eyes to that mindset of like you present people with something new and it's like they can't absorb it, right? Especially I would imagine when a doctor is trained, you guys go through endless amount of schooling, endless amount of tests, endless amount of residency, endless, supervision in a lot of cases. And then to have that challenged, I mean, it almost like probably challenges someone's identity in a way. And so I think it's hard sometimes for people to just kind of have that ability mentally to overcome all the programming that they've had to
Yeah.
think a certain
But
way.
isn't that sad? Because you are the guide to your patient's health.
Yes.
And if you reject possibilities, then you just rejected all these possibilities for your patients. You reject it for them. Yeah,
And you almost abandon that core thing that I mentioned earlier. I think doctors have where it's like, I want to help people. Like
exactly.
you
Exactly.
should, yeah, in the best way possible to help them and empower them to be their
Right,
healthiest, most
right.
efficient
Yeah,
self.
and I feel like my mission is not only to help people do better, but is to and empower them. But I'm also empowering doctors. I'm giving them a chance to see, look how much you can help a patient. Look how fun medicine can be, that you can be truly effective in a way that you've never had a chance to be. So that's what I want to bring back, the excitement about medicine.
Yeah. And the evolution of it, right? Like it's changing. And that's what's so fascinating to me about the last couple of years is I shared with you and the audience already knows like my stem cell journey. the peptides that I use, which I want to ask you about in just a second. But the way that I've been able to change and improve my life just by having a doctor that's focused on root causes and longevity and things like that, as opposed to going to 17 different doctors that are all, specializing in one part of the body. And I think it's just been such an eye-opening, life-changing experience for me. And I want that for so many other people. It just feels like, one, a lot of them don't understand it, which is why I think these conversations are super important to have and get out to more people. But I think too, it's just, you go to your doctor and you ask them something that's outside of their little silo of knowledge and expertise, and they might refer you to another doctor, but they don't know, because they don't have that sort of holistic look at what's going on in the human body.
Yeah, but those doctors are going to become obsolete. So unfortunately, if you don't move with the times, then you're just going to be, like a speck in history that's considered, like against history and against progress, because there are better ways of doing things. We're always progressing. So yeah, but the good thing is more and more doctors are waking up. It's pretty exciting. Yeah, it's like a wave. The wave is carrying everybody, just like the peptide wave.
Yeah.
Everybody hopping on it. I'm shocked of how everybody and the
So
grandmother.
fast. And it happened so fast. And I actually, the work you're doing with stem cells, obviously great. I could talk to you about that I know we're coming up on time. I could talk to you. I have a lot more questions on that. I'm going to ask you one more, but then I just want to get your thoughts on peptides. But before we do that, all of the work that you've said on stem cells, like you can do joint repair, you can do kind of general repair. What are some of the top use cases for stem cells? And then what are some of the things that might be myths about what they maybe can't do or shouldn't be relied on for?
Okay. So there are definitely conditions that respond faster and really well to stem cell therapy, and some are more challenging. So the ones that are easy, the musculoskeletal problems. So that's kind of like the bread and butter of stem cell therapy. You have muscle tear, you got, a tendon tear, you joint problems. So those are great. And then autoimmune conditions. That to me, that's like good. You have autoimmune issues, I can help you, because there's so much evidence. Not only there's so much evidence, but clinically I've seen so much success. So that's, that's really fun. And then people have all kinds of, other problems. The cardiovascular system, it can be amazing for heart repair. I have lungs. I love treating the lungs because the results are absolutely amazing. Of course, that's one of the first places the cells aggregate. And then if you have lung pathology, the cells will stay. If your lungs are fine, no, they don't get trapped there. I want to correct the record. They end up going into systemic circulation. There's no reason for them to just sit there. They actually disappear and go into systemic circulation, as they found out in research. But if you just you have lung pathology, then they will stay and start to break down scar tissue, start to restructure and form newer and healthier cells. And then we've had success with people with Parkinson's, some brain condition, dementia, traumatic brain injury. Really good success.
Autism thing is mind-blowing to me. I hadn't heard that before.
Yeah. So autism, I actually have a lecture on YouTube specifically about autism. So if anyone's interested. So, I give lecture at different conferences. So one is about anti-aging benefits of stem cells. And all these are on YouTube. And one is on autoimmune conditions or post long COVID. One is on autism. So those are more kind of specific. There's one that's just general on diverse diseases, because I ran through all of them, because I have an academy. I train all these doctors, and we have we go through every category. So I would just run everything really fast, giving people like a breadth of look at the evidence, because one of the major complaints I hear from these doctors is that, oh, there's no evidence that stem cell therapy actually works. It sounds amazing, but there's no evidence. My God, if you just look and let me show you the evidence. So that's the kind of the purpose. Let's look at the evidence. People have been studying this for decades now. So let's look at what's out there. And then, so anti-aging, that's really fun, because you are preventing decline, and you are keeping people in a youthful state, and you help them live longer. Of course, we don't have direct longevity statistics, because that's going to take many decades.
Yeah.
And usually the research will be dead before the results are ready. But we can study young animals, so we can tell how much longer an animal can live. So we have that evidence. But we also have seen from dissecting these animals' body, their brain, their muscles, that everything in those cells of these organs have been reverted back to the younger state with every parameter you're
Wow.
looking at. So that's pretty solid evidence that we are rejuvenating the body. So
Wow.
that's really fun. Not only people are happy and they stay happy, right? They do well and they're vibrant, but we also help them even if they have minor issues. Like we have a lot of successful, executives, entrepreneurs who have made a lot of money in their lives and now they're in their 60s, 70s, they're ready to enjoy life with their wives and they want to go places, but no, got aches and pains, can't sleep well. And so then they come to get stem cell therapy. Those are small problems. It's not like they have a
Mm-hmm.
major medical diagnosis. But then after stem cell therapy, all these problems were going away. And they, it's not uncommon when they tell me, oh, I feel like I'm 35 again. So they feel like they're back in their younger years. So yeah, so that is fun. So not
And
only we
is that
help,
is that because they're like, sorry, churning over like old cells, stem cells
yeah,
that
I
are
think the
as old as your
inflammation.
body?
So
Yeah.
all
Okay.
these inflammation in your body are calmed down, right? Inflammation is the antithesis of regeneration. If you don't calm the inflammation, there's no regeneration that can happen. So it just gets stuck. So your body, all these people in their 60s, 70s, when there are aches and pains and, brain fogs, their body's stuck in inflammation. So now if we can calm the inflammation, all of a sudden everything is in clarity, right? Your body is in clarity. Now we can function at a higher state. And another fun thing about these new younger cells is that it can actually give the body new mitochondria, which is really fun. So your cells get infused with this newer mitochondria. So it's elevating your cellular energy, including your immune cells energy. So if your immune cells are functioning at a better state with this modulation from the stem cells, now the immune system, of course, is highly intelligent. It helps the repair and regeneration of all your organs and help protect you against cancer and everything. So immune senescence is a big part of our aging process. So if you can make the immune system function at a younger state, your body has a chance of functioning at a younger state.
That makes perfect sense to me, especially when you think about kids and how they bounce back from being sick a lot quicker than we do as adults.
Exactly. And they injure their bodies, at a way higher rate, right? They're
Yeah.
crazy.
Yeah. I mean, yeah, they do. Work you're doing with stem cells, and I didn't know all of these use cases. I think there is way more we could dig into there. But I wanted to ask you a little bit about peptides. They are all the rage right now on the internet, from influencers to longevity doctors and people that are working from a functional perspective like you. I also just watched your Instagram with your peptide stack, which was more like a which more like a peptide tower. I sent it over to my friends. He's like, "That's a peptide tower."
That's funny.
But what are some of the use cases generally, because we don't have a lot of time to get into it, of peptides, and how should people be looking at them from a medical perspective? Because I don't think they should be listening to influencers. So as a doctor and you're using them and implementing them into your practice, what are the good use cases and how should people view peptides from a use case and safety perspective?
Yeah, so when people come to clinic, I always just look at what they're looking for. I think some peptides are universally helpful. My favorite would be epitalon. There's so much research about what it can do to rejuvenate the cardiovascular system, can extend the telomere, it's protective against all age-related diseases. So I think everybody should be taking epitalon. But there are other things that are more tailored. If you, of course, need a lot of weight loss peptides, there's the, GLP-1s, of course, MOTS-C, 5-amino-1-MQ, there's the melanotan. So there are all these things that can help with weight loss, and there are a lot of brain peptides, C-Lang, Cmax, cerebral lysin, dihexa. So these are very exciting, PE2228. So you want to tailor to see what a person may need. And of course, there's so much science. I mean, each peptide, literally, they're kind of like a medication on their own, right? It's
Mm-hmm.
really, if you look at, they all have their individual functions, history, their pharmacodynamics and kinetics, how they function in the body and what it can be used with and what time to take it. It's complex. That's why it's a little crazy in the field, because all of a sudden everybody is endowed with 40 medications like you can use for all these things, right? But no one knows, but each medication takes studying, right? It takes a lot. So people are just like, this is all, they're all ours to use now. So it's a little bit crazy. So that's why having a doctor that can guide you is really important. But
Yes,
it,
please, to anyone out there, do please get a doctor to help you with your peptides and where to get them and all of that, because it's the wild, wild west out there right now. And your
it
favorite
is wild. And
influencer,
I've heard people getting, problems, symptoms, and, that from using things that are not pure are, problematic, even from sources that they think are good, that carry the pharmacy label in the US. So just because you somehow, somebody got a pharmacy title or a license doesn't mean that what they're giving you is the best. I mean, there are all kinds of players out there. They may be importing something and without proper testing, and they just give it to you because it's expedient. It's quick money. And so just be very careful. We send out all our products out to third party testing, a US lab. So it doesn't matter where it came from. We're going to test it. I'm going to make sure that this is the right things to give to my patients. So yeah, it is exciting, but people have to be a little bit more cautious. We're injecting them in the body after all. Yeah.
that's the whole thing. Like when you're injecting something, it doesn't have to go through your system to process and, get diluted or whatever. So I just please, I'm seeing so much of it. I think there's exciting things. I've been using peptides now for a year and a half for varying different things and all under a doctor care. So please be safe with that. I want to encourage everyone not to buy something and dose yourself and inject yourself without working with a physician. So that's
Yeah.
important. Yeah.
Yeah.
Yeah. Go ahead if you had something to say.
Yeah, I think we're so lucky these days that we have all these tricks. You know, I think it's really amazing. It's really a gift that is making life so much easier. Even for people who struggle with weight, with chronic inability to lose weight. I mean, that's very devastating. It affects your entire perception of yourself. But now we have the tools, and not only allow you to get into a better shape, but improve your health at the same time. And it's really wonderful. I mean, I can't tell you how vastly superior it is to gastric bypass surgery. So,
I have a friend who did that many years ago and, has had some success now with peptides. So
mm,
it's great to hear that. Yeah, just be safe about it. That's my thing. This has been such a wonderful conversation. Like I said before we record, I think I could talk to you for hours and hours. So I'd love to have you back on sometime and we can dive into some of the other work that you do. But
gosh. Mhm.
before
There's
we
so much
go,
about stem cells we haven't even talked about. There's
I know stem cells, like other, laser light therapy. There's so many things that you're doing. Hormone replacement. I don't think people have any understanding of the importance of our hormones play in our everyday health, which you dabbled on, but so many other things. But before we go, I'll give you a chance to ask me anything, and then we'll tell people how they can get in touch with you and work with you in your practice if they want to.
okay. Well, so you already told me what made the biggest impact on your mental health, which is actually just walking, right? Walking twice
Literally.
a day. I mean, that's incredible. And what about, I'm curious about peptides because you've been using it for a year and a half. What are the peptides that have made the biggest difference for you?
So, great question. So, I started off with the Wolverine Protocol, BPC 157 and TB 500, as sort of a supplement for my stem cells on my hip. I noticed with those that I I guess it would be the inflammation went down. I noticed it kind of like kicked me up to another level with my hip. But I will say last November, I added Cartilax to that, which is supposed to stimulate cartilage growth. And when I added that, I felt the best that I had felt in my hip. And I even went something like, it was like 6 to 8 weeks with zero pain, to the point
Mhm.
where I was like waiting for it to just like digress again. And yeah, but like even now, like when I cycle on those, again, all with the help of my doctor, I cycle on those and Cartilax and stuff, I can feel the best that I have in my hip, and I can get to like 80, 90% of 100%. Whereas there were points before all of this where I literally was like, I'm I'm not gonna be able to walk unless I get this hip replacement. And there were days where just getting out of bed was so painful because I tore my labrum and then it just was gone a couple of years later. There was no cartilage left. So those two, I would say, had the biggest impact on me from that perspective. Now, I just recently started KLOW, KLOW. Hopefully for skin improvements. So we'll see how that goes. I think I'm 2 weeks into that. And then I also started around the same time. It's AOD 964
Right.
for fat loss.
Right.
And then
Right.
I did, yeah, that one. So I'm 3 weeks into that maybe.
Noticing
And then
anything?
I am on the sides. I get a spare tire that's like impossible to lose almost no matter what I do. So I've noticed like my love handles are shrinking a little bit.
Wow.
Yeah.
Nice.
So yeah, but again, it's just I heard too from my doctor, it's like another week or two before you start to really experience the benefits. And then I did another blend, ipamorelin and something.
CJC 1295. Yeah.
That's the one. Yeah, that's the one. And then I did a cycle of that, but I'm off of that right now. So I guess that was another good one. That helped me with strength because I was working with a fitness coach at the time, and I was able to like progressively overload after a week where it would take me like 2 to 3 before that. And then the cool thing is I've kept that strength. Like I'm still my overloading has slowed again, but like I've still been able to keep that strength and I haven't had to like go down in weight or anything. I'm just not progressing as quickly. So
beautiful.
I've had, lots of success with it. And my friends joke now, they always send me stuff like, dude, all you do is talk about peptides. I'm like, they are just changing everything. So
yeah, imagine how fun, how exciting.
Yeah.
You got solutions. Yeah,
exactly.
fantastic. Yeah, I like everything you're talking about, but it's great. Have fun.
Yeah. I'm trying. And again, to everyone, just do it with a doctor or do it with Dr. Joy if you want to optimize your health and your longevity. So tell people, how can they get in touch with you? And where can they find you?
We see people everywhere. I mean, we can do telemedicine, so we can talk to you anywhere. And then a majority of patients actually fly in, take a plane to come see us. But we can also deliver treatments, in people's homes. So yeah, our clinic is in Los Angeles, and but you can reach me on probably the easiest way, just use on Instagram. So it's just Dr._Joy_Kong, Kong, and then I have my personal website that has everything that's in it, including my clinic. That's just joykongmd.com, and my YouTube channel. Please go to my YouTube channel and learn for free. It's got so much information. I think I put out more information on stem cell therapy than anybody I've ever seen. I just try to answer questions. There's just so many questions and there's so much confusion in the field. And, people are given just, advice. Yeah. And I know sometimes, because I've heard some of these doctors speak and they were giving information that were not accurate. And it shows that they didn't understand, some of the basics in science. So you really want to get it from a good source. So that's what I try to do. And if there's any doctors out there listening to this, you want to get more trained, I have an academy, which is under aaict.org. So we do have certification training courses 3 times a year now, and an online training course. So yeah, I'm here to help make this world a better place, right? We have better healing tools and everybody live better and happier.
And I think that's admirable. And all of those links, including the link to the Academy, will be in the show notes. So you can click down there, get directly there with, we're all looking for less clicks to connect with you on Instagram, your website, all of those links, and your YouTube. Again, I'd love to do this again sometime. Thank you for your time. You've been so generous. And, to everyone listening out there, reach out to Dr. Joy and we'll have you again sometime. Thanks for coming on.
Thank you, Nick. It's been a great conversation.
Thank you for joining us on this week's episode of Eyes Wide Open. If you enjoy the show, the best way to support us is by sharing or dropping a review. For more information and content, check out engagewithnick.com or find me on Instagram at nthompson513. Don't go through life blind. Do the work so you can show up in the world with your eyes wide open.